A very common question patients ask is, why do I have to restore the back teeth if I can't see them anyways? One important reason is that the back teeth are the ones which provide the support for your bite. As you are chewing and eating, food is usually pushed towards the back because the forces there are stronger. If all the back teeth are missing and you're only left with the front teeth, the smile might look good for a while, but over time, overloading can occur. When that happens, the teeth can begin to flare out and begin to move. In such a situation, besides becoming unaesthetic, it becomes very difficult when we try to restore the missing spaces. If you have a missing premolar or a molar, there is nothing to prevent the neighboring teeth from drifting into the space or the opposing tooth from getting longer. Over time, this causes change in your bite and might predispose you to developing things like dental decay or gum disease around the neighboring teeth. In a more extreme situation, sometimes patients lose all their back teeth before deciding to do anything for treatment. For all the reasons above, we always advise patients that when you think of a missing tooth, don't just think about the tooth in isolation. Think about how it plays a role in your smile, in your bite, and in your overall oral health.